If you've been dealing with low back pain, one of the biggest mistakes people make is assuming all low back pain is the same. It's not. Low back pain can come from several different structures. Sometimes it's coming from restricted spinal joints. Sometimes it's a muscle strain. Sometimes it's irritation in the facet joints. And sometimes it's low back pain can involve deeper structures like the discs or even nerve irritation. That's why in our office, the first priority is not just trying to cover up symptoms. The first priority is identifying what is the actual causing the pain. A lot of patients describe low back pain as stiffness, aching, tightness, sharp pain with certain movements, or pain when they try to stand up after sitting too long. Other people notice trouble bending forward, twisting, lifting, or even just getting comfortable when they've been in one position for too long. In many cases, low back pain develops from mechanical stress building up over time. That can come from prolonged sitting, poor posture, repetitive bending, lifting, twisting, deconditioning, or simply moving poorly day after day. In other cases, it can start from a specific injury like lifting something awkwardly, exercising incorrectly, or being involved in a car accident. One common source of low back pain is joint dysfunction, sometimes referred to as a subluxation. When the joints in the low back stop moving properly, they can become stiff, irritated, and inflamed. That often creates compensatory muscle tension around the area, which can make the back feel even tighter and more painful. Another common cause is muscle strain. This can happen when the low back muscles are overloaded, fatigued, or forced to stabilize around irritated joints. That often creates tightness, guarding, trigger points, and pain with movement. Facet joints can also be a source of low back pain. These joints are small joints in the back of the spine, and when they become irritated, patients often notice more painful with standing upright, leaning backward, or rotating. There are also cases where disc-related pressure or nerve irritation may be part of the picture. When symptoms go deeper than simple stiffness and start traveling into the hip or leg, that deserves a more focused evaluation. That's why a good exam matters. At our office in Olathe, we evaluate low back pain by looking at a full mechanical picture. We want to determine whether your symptoms are being driven more by joint restriction, muscular strain, disc involvement, or nerve irritation. That distinction matters because treatment should match the diagnosis. Treatment may include chiropractic adjustments to restore motion and reduce joint irritation. It may include spinal decompression when the goal is to reduce pressure within the spine and improve how the low back functions. In cases with a lot of muscular tension, dry kneeling may be helpful to reduce tightness and improve mobility. We may also use recovery-based therapies like hydromassage or cupping to calm the surrounding musculature. Another thing patients will ask all the time is why low back pain keeps coming back. Usually because the underlying mechanical stress never fully changed. If you keep sitting the same way, moving the same way, overloading the same tissue, and never address the source of the dysfunction, pain often returns. That's especially common in people with desk jobs, repetitive lifting demands, weak stabilizing muscles, or a history of reoccurring flare-ups. So if your low back pain has been lingering, keeps returning, or is starting to interfere with daily activity, it may be time to have it evaluated properly. And if your symptoms are traveling into the leg or you suspect disc or nerve involvement, that should be assessed even more carefully. If you're in Olathe and dealing with low back pain, our goal is to identify the cause and guide the right treatment plan for your specific condition. Thank you.